Hello, my name is Sofia Zapata, and today we're going to be doing a video on vital signs. And I like this vital signs videos that we do every week. Sorry, excuse me. Because these are like basic but also very important skills that we should know when we go out there on the field. So I like doing these vital signs videos every week. It helps me out and makes me feel like I'm doing more practice, more experience, and getting better at it. So let's get right to it. Today I'm going to be using this pillow here just because this part of the pillow feels like an arm, and last time I tried to do a patient, it didn't go so well and my notifications were on. But anyway, the first thing you do is you go inside the clinic. Well, not the clinic, the office, the little waiting rooms. You're going to go in there and you're going to introduce yourself. You're going to tell the patient why they're there. You're going to verify the patient by asking them their name and date of birth, and also answer any questions that they have for you. Once again, let them know that they're there to get their vital signs done. And after you do that, you're going to do 4 vital signs, which is the blood pressure, the pulse, the respiration, and the temperature. So let's get right to the blood pressure. I already have put on the blood pressure cuff on the blood pressure cuff on the patient. Okay. And when you have done this, make sure where it says the artery, it's going to go right there. Artery right here. Here. Once you've done that, you are going to pump this up to 160. 160. And with this valve right here, make sure you turn it to the right. That way it is secure and you can pump it up. You can either look at it. We'll look at it. I think we will look at it since it isn't a real patient. But you see you have to pump it up all the way to 160. My dog is like, what is that? 160. And when that happens, when that happens, you are going to look at the first beating that this needle does. In the first beating, that will be your systolic number. And the last beating of the patient's heart is the diastolic number. It's the more you do it, like I said, the more I feel like I know how to do a blood pressure, right? And it's always even numbers. It will never be like a 56. A 55. It's always like even numbers, not odd. So that's what's going to happen with the blood pressure. And make sure you document these readings on the patient health record. When you're done with that, you're going to go ahead and do the pulse. And you can do the pulse and the respirations at the same time. It's best if the patient doesn't know that you are getting their heartbeat, their respirations done, because then they will stop breathing or they'll breathe fast. So it's better if they don't know. So I have my watch here. Depending on the doctor, they'll let you know if they want you to do it for a whole minute or if they'll let you do it for 30 seconds, and you can times that times 2. So let's do my pulse first. And the way I can check my pulse is right here, right by where the thumb is at. I will check my pulse. So let me see. It's going to be really quiet right now, but I'm going to check for my pulse. And it's for 30 seconds. So let's just pretend that I'm doing my pulse, right? And 30 seconds pass by. Let's say I get like 11 pumps for 30 seconds. You times that times 2, and it would be 22 pumps for your pulse, right? And for respiration, you can do 1, 1, 2, 2, 3, 3. Right? So when that happens for 30 seconds, how many times the patient breathe? You times that times 2, and you will get the results. Also for temperature, a normal reading would be like a 98.7, and something, a reading, not something, sorry, a reading more than like 100 or 101, it's a fever. So that's for a patient that would normally be arranged for the patient if they're ill or have a fever. I think that's it for today. I kind of want to get into it next week, and the sessions that are coming by, I kind of want to get into it, like of a blood pressure in one session of a video of vital signs. Then I'd like to do the pulse, then the respiration, then I like to talk about the temperature, if that is okay. But other than that, this was my video. Thank you for watching. I am Sofia Zapata. I am part of the MA program of Northwest College. Thank you.